Good afternoon, Mr. Jones. My name is Esther. I'm a student nurse and I'll be working with you today. I'll first get started by washing my hands for 20 seconds. How are you doing today? Good. Can you tell me your name and date of birth, please? Carly Jones, June 11, 1992. Thank you. Do you have any allergies that I should be aware about, like food, medication, latex or chlorhexidine, anything like that? Any allergies? No? Okay. And are you in any pain or discomfort today? No? Okay. All right, I've washed my hands for 20 seconds. Is it all right if I check your name, your wristband? Thank you. All right, thank you. Everything confirms. So today I'll be changing your central venous access device dressing, or CVAD dressing for short. Your central venous access device is what's located on the left side of your chest, or your left subclavicle vein. And the dressing on top of that needs to be changed every 7 days. It was about 7 days since we last changed it, so I'll change it for you today. I just need to gather my supplies. I'm going to remove the old dressing. Then I'll also take a look at your central venous access device and your skin to see if there's any signs of inflammation or infection, and if there are any cracks or leaks in the tubing. Then I'll put a new dressing on you, and then we'll be good to go. Do you have any questions for me? No? Okay, and are you experiencing any pain? No pain? All right. We'll get started. I'm gonna get my supplies, and then I'll be back, okay? Great. Hello, Mr. Jones. I've gathered all my supplies here. And I'm gonna perform hand hygiene. Put on my first set of gloves. I'm going to wipe the table for 30 seconds. Alright, make sure to get all the edges. I've cleaned the table for 30 seconds. I'm going to remove my gloves, perform hand hygiene, and let this table dry for 2 minutes. While this table is drying for 2 minutes, Mr. Jones, I will have to ask if you can turn your head during this procedure. This is also why both you and I are wearing masks. This is to prevent any limit the risk of any contamination by introducing new bacteria. So that's why we ask that you have a mask on, as well as myself, and for you to turn your head. Could I assist you in turning your head? Thank you. All right, now that you have your head turned, I'm going to perform hand hygiene, and I'll prepare my supplies. All right. And my sterile glove, my bio patch, also my pen. Gonna peel open the tray. I'm gonna remove the mask since both my patient and I are wearing masks. I'm also gonna remove the sterile gloves. I'm gonna drop in my bio patch. How are you feeling, Mr. Jones? Good? Any pain or discomfort? No? All right. I have my supplies ready. I'm going to perform hand hygiene. Going to put on new gloves. All right, Mr. Jones. I'm going to remove your old dressing, okay? Please keep your head turned. Thank you. So looking at your old dressing, I see that it's a clear Tegaderm dressing. I see that it's clean, dry, and intact. Your skin doesn't look red or irritated. I don't see signs of infection, but I'll check again and document it once we're done.
And I see that the central venous access device is located in the left subclavicle vein. And I don't think there's any cracks or leaks, but I'll check again once I remove the dressing. And the catheter is 25 centimeters as documented by the previous nurse. All right, Mr. Jones, please keep your head turned, and I will start removing the dressing. Please let me know if you feel any discomfort or pain. Just gonna start around the edges. I'm gonna keep my hand on your tubing so that it's not really tugging. How are you feeling, Mr. Jones? Any pain? Any discomfort? No? Okay, good. All right, your dressing is off. Any pain or discomfort, Mr. Jones? No? All right. Looking at your skin, it's not red or inflamed. I don't see any signs of infection. I don't see any marks or discharge or liquid coming out. Your CVAD is located in your left subclavicle vein. The central venous access device is 25 centimeters, as documented by the last nurse, and I'll make a documentation of that, as well as your skin, that it's all good, it's not inflamed, or doesn't look like there's any signs of infection, and there's not any leaks or cracks in the tubing, and I'll also note that you do not have any pain. All right, please keep your head turned, Mr. Jones, as I prepare my sterile gloves. I'm going to make sure not to go beyond the 1-inch border. All right, I have my sterile gloves on. I'm going to dispose of the packaging. How are you doing, Mr. Jones? Good. Any pain or discomfort? No? Good. Just going to prepare my Tegaderm here, which is the dressing that I'll put on you today. All right, Mr. Jones, I'm going to start cleaning your skin, okay? I'm going to crack the chlorhexidine and shake it. I'll clean your skin for 30 seconds. All right, I've cleaned your skin for 30 seconds. I'm going to clean the tubing. All right, I've cleaned your skin and the tubing, Mr. Jones. I'm going to let this dry for 30 seconds. Now that it's been dry, after 30 seconds, I'm going to get my bio patch. Hold it like a taco. Slip that right on. I have my stress loop. I'm gonna get my Tegaderm here. There you go. Do you feel any pain or discomfort, Mr. Jones? No pain or discomfort? Good. I'm going to use some tape here, Mr. Jones. And this is to, while you're moving around, to make sure that the tubing is all secure. It's not going to move around or anything like that. There you go. I'm going to remove this labeling. I'm going to use my pen. And I'm going to write my initials, since I'm the one who put the dressing on. The date, which is October 2nd. And the time, which is 1500. I'm going to put this labeling put this labeling to the place where I can see it, or the next nurse can see it. Are you feeling any pain or discomfort by any chance? No? Okay. Okay. I'm going to clean my side over here. Remove my gloves and perform hand hygiene. All right, Mr. Jones, I'm all done. Could I assist you in turning your head back? Thank you. All right, so Mr. Jones, we are all good. Are you feeling any pain or discomfort? No? All right, good. So I'll make a documentation in your charting that I just changed your dressing. It's October 2nd, and it's about 1500. And I'll document that your skin was not red or inflamed. I didn't see any signs of infection. I'll also document the length of your central venous access device, which was 25 centimeters, as previously documented by the last nurse. And there were no cracks or leaks in the tubing. And I saw that it's placed in the left subclavicle vein, and everything looked good, and you weren't in any pain. So I think we're all done here. I'll make a note of that in your documentation, and I'll check in with you later. Is there anything else, any concerns, anything else I can get for you? No? All right. Thank you very much for your time, and I'll check in with you later, okay? All right, thank you.